2022 Benefits Open Enrollment Overview. Today we will cover some exciting enhancements to several benefits insurance plans for 2022, including what inspired these changes. To say that the COVID-19 pandemic has changed our lives would be an understatement. It has changed the way we work, learn, and interact. Social distancing guidelines have led to a more virtual existence, both personally and professionally. The pandemic has emphasized the importance of mental health and has driven the acceptance of virtual healthcare delivery. In our society, we tend to gloss over mental health issues. If a person breaks a leg, they go to the doctor. When somebody experiences a major life disruption, feelings of isolation, or an overwhelming sense of insecurity, they tend to keep it to themselves. In a recent survey, 55% of respondents reported experiencing mental health issues since the onset of the pandemic. Yet those who do have the courage to seek out help find it takes weeks to get an appointment due to a shortage in mental health professionals. On October 1st, Schneider introduced the new Enhanced Employee Assistance Program through SupportLink. SupportLink still offers the same traditional, in-person confidential consultations with a mental health professional, but also offers in-the-moment telephonic care between appointments. For those who prefer an informal experience, SupportLink offers text therapy where you can connect with a counselor through their texting app. You can also explore Amino, a digital tool that improves your emotional health. Finally, SupportLink also offers referrals to experts for legal, financial, or convenience services. Turning our attention to the health plan, as a reminder, we are self-funded, which means you and Schneider are the insurance company. The plan is designed in a way that Schneider pays 65% of total costs and members pay 35% through premiums and plan design. During the pandemic, our members took more time to consider how to access healthcare and have been more open to virtual care. Our plan has experienced cost savings through these lower care options. In the past year, 98% of medical claims were through in-network providers. 38% of those were with premium providers. We saw a 9% reduction in emergency room visits, appropriately shifting non-urgent issues to a lower cost point like virtual visits and urgent care visits. On the pharmacy side, 89% of our prescriptions were filled with a generic drug. These are all examples of smart consumer decisions. In addition, we've seen a reduction in elective procedures like back, shoulder, and knee surgeries. And while we've had our share of high-cost claims for treating illnesses like cancer, heart attack, accidents, and COVID, the change in participant behavior resulted in lower than expected costs in the past year. With this consideration, as well as reviewing updated benchmarking data, Schneider is reducing healthcare premiums for 2022. Outlined here are the premiums. The amount below each rate in italics is the savings in 2022 over the current 2021 rates. If you participate in wellness, you can complete 2 activities for rewards. The first is to declare your tobacco nicotine status and receive a premium reduction. And the second is to simply complete a biometric screening and receive a deposit into your HRA account. We receive feedback that those who are healthy and have very few medical claims do not perceive the HRA deposit as valuable. Therefore, in 2022, we will no longer be funding the HRA and instead will further reduce your premiums by $38 a month. Here are the 2022 premiums if you participate in both wellness activities. As you can see, the lowest possible premium is significantly lower than the 2021 premiums. You can save $60 a month in the associate-only plan and over $100 a month in the family plan. Before we continue with the rest of the plan changes, I want to pause and acknowledge that our lower costs may be a result of skipped or delayed care. 4 out of 10 U.S. adults have reported delaying or avoiding care during the pandemic. Healthcare providers have gone to great lengths to ensure that keeping those appointments are safe for everyone. In a time when we need to be able to focus on keeping ourselves as healthy as we can, we must not skip preventive visits. When we miss early signs of disease, treatment becomes more complex, costly, and can impact the patient's prognosis. If you haven't already, please schedule your preventive visit today. Now returning to plan design. The health plan deductible will remain the same in 2022. As shown here, our deductible has only been increased once in the past 8 years and is well aligned to benchmarking. There will be no change to the family maximum out-of-pocket, and the most an individual will pay will align to the IRS maximum at $8,700. This year, we are pleased to introduce a new feature. When you enroll in the medical plan, you will have a choice between 2 healthcare accounts, a health reimbursement account, or HRA, or a health savings account known as an HSA. The biggest difference between the accounts is who owns and funds the account and what expenses can be paid by the accounts. For ownership, with the HRA, Schneider owns the account. This means if you leave the plan, any funds in your HRA are forfeited and stay with the plan. Under the HSA, you own the bank account, and if you leave the plan, the HSA bank account stays with you. As for funding the account, Schneider funds $250 or $500 into your HRA each year. If you stay enrolled in the plan, unused funds roll over to the next plan year. If you choose the HSA, you fund the account through payroll deductions or direct payments to the bank, tax-free, up to the IRS maximum. For 2022, the maximum for single is $3,650 and family is $7,300. You can change your contribution amount at any time, and funds will remain in the account until you spend them. To use the funds, HRA dollars can only be used to pay for covered services under the Schneider Medical Plan. With the HSA, any IRS eligible expense for medical, dental, or vision can be used with the HSA funds. Many people use the HSA as a retirement vehicle because you can invest your funds and allow them to build over time to pay for medical expenses into retirement. Both the HRA and HSA can be paired with a compatible use it or lose it flexible spending account for further tax savings. An HSA is an excellent savings option. However, if you're considering the HSA, there are many tax laws that you are responsible for understanding and complying with. We offer several resources on the benefits portal, or consult with your tax advisor for complete details. We continue to find ways to address rising prescription drug costs. We've been offered deeper discounts by narrowing our large pharmacy retail network to Walgreens. This means starting January 2022, CVS will become out-of-network. Other retail pharmacies will continue to be in-network, like Costco, Walmart, Kroger, and Meijer, as well as some select independent pharmacies. If you have a maintenance medication at CVS, OptumRx will be contacting you to assist you in moving your prescription to an in-network pharmacy. This spring, we performed a pilot with Sword Health, a virtual physical therapy solution. This solution allows you to address pain from your home or truck. The pilot was successful with an average of 30 sessions per participant, and most sessions were performed in the evening or weekend. Many had reduction in pain and reduction in surgery intent. Sword will be available to health plan members starting January 1st. This solution is intended to help members who cannot access an on-site Atlas physical therapy location. Atlas provides our health plan members access to physical therapy at these Schneider locations at no cost to the member. We recently extended services for another 2 years, but with a price increase. We also have reduced hours at several locations because appointments have gone unfilled. If you are a member of the health plan with access to Atlas, please consider them for your physical therapy needs so we can continue to offer this convenient service in the future. When it's time to begin thinking about Medicare coverage, it's often a confusing, overwhelming decision. To help our associates, we have partnered with SmartConnect to bring you Medicare education, consultation on plans, and ongoing support after you purchase a plan. You can find more information about this new service on the benefits portal. This year, we took several lines of coverage to market and had success negotiating better premiums and, in most cases, enhanced plan designs. Starting with vision. We took the vision plans to market, and using that information, we were successful negotiating a 3-year contract with IMED. There will be no change to the vision exam plan. Schneider pays the premiums for this plan, which provides you and your enrolled dependents an eye exam each year for only $10. The optional buy-up vision materials plan has new lower premiums. There are no changes to the plan design, which provides allowances to purchase glasses and contacts. We took the accident insurance plan to market and will be moving our coverage from MetLife to Voya. We have secured significantly lower premiums for the next 3 years shown here. In addition, Voya has enhanced the benefit plan by increasing the amount they will pay for 19 payable events. For example, burns are covered under our current plan with a max payable benefit of $10,000. The new Voya plan will pay up to $15,000. Critical illness will also be moving from MetLife to Voya. Critical illness insurance pays a flat dollar amount when you experience a critical illness such as heart attack or cancer. We have secured significantly lower premiums, which are based on the amount of coverage you choose, your age, and tobacco use. But nearly every age band will experience a premium reduction by as much as 50%. In addition, Voya has enhanced the benefit plan design, including the removal of our current pre-existing clause, and when you enroll in coverage for yourself, your enrolled dependent child is covered automatically. Disability insurance will continue through Voya, but because of recent pay increases, we asked Voya to increase weekly payments from $300 to $400 a week for drivers in their first year of employment. They agreed to the increase at the same rate per $100 of coverage. Remember, this plan will pay you tax-free money if you're unable to work due to a qualified illness or injury for an extended period of time. Hospital indemnity insurance will move from Schneider Healthcare to Voya. This plan pays you a flat amount if you are admitted or stay overnight at a hospital or an intensive care unit. With our current plan, this benefit is only payable once a year, but Voya will pay the admission benefit up to 8 times per year. Despite the significant plan design enhancement, we were successful securing slightly lower premiums for the next 3 years. And for our final change, we took the MetLife prepaid family legal plan to market, and we will be moving this coverage to RAG, one of the 3 largest legal insurance providers in the world. This coverage is like having a lawyer on retainer to help you and your family work through issues that may require consultation or representation. RAG has enhanced the covered services, and we have secured these benefits at a slightly lower premium. Now let's cover the 2022 open enrollment. It is important that you read through the changes outlined in the 2022 open enrollment guides. All these resources are available on the benefits portal. Open enrollment is the one time of year to review your benefit elections and make any changes as you feel necessary. It begins on Monday, November 1st, and closes on Tuesday, November 23rd. To enroll, log on to the benefits portal from any internet device, such as a personal computer, smartphone, or tablet. If you need any assistance, the Benefits Service Center is here to help. Use the chat feature in the benefits portal or contact the Benefits Service Center directly. Have a wonderful and smooth enrollment season. Be well and be safe.